I'm Professor Mark McCarthy from the University of Oxford. The research that's just been published in Nature represents a large collaborative effort involving over 300 scientists in more than 20 countries across the globe. By collecting genetic data on many tens of thousands of individuals, some with diabetes and some without, we've been able to unravel some of the specific mechanisms that are involved in influencing risk of type 2 diabetes, and we hope that this information will allow us to develop better ways of preventing and treating this condition. Type 2 diabetes is the commoner form of diabetes. People may be familiar with type 1 diabetes, which is the form that comes on early in life, often in children, and requires daily treatment with insulin injections. Type 2 diabetes is the form of diabetes that comes on in later life. Like all forms of diabetes, it's related to high blood sugar, and that high blood sugar, if it's left untreated for quite some time, can lead to complications such as blindness, kidney failure, and an accelerated risk of heart disease. There's been a long-standing debate about whether the DNA differences that are important for the common complex diseases like diabetes, but also schizophrenia, heart disease and so on, whether those are mostly composed of common DNA differences that are shared amongst many people in a population, or whether each individual with diabetes or one of those other diseases has their own specific cause of diabetes from a genetic perspective that's related to a DNA difference that really is they have and maybe their family members have, but isn't widely shared in the population. And that may seem a pretty arcane and unimportant and rather technical difference, but it has very important ramifications in terms of the ways in which we might be able to personalize treatment of diabetes. And what we've been able to show pretty convincingly, and this is because we've been able to use DNA sequencing to compare not just the common shared differences, but also some of the rare and private differences, we've been able to show that a lot of the variation is in the former camp. In other words, most of the DNA differences that seem to contribute to whether you or I get type 2 diabetes seem to be ones that are shared widely in the population. We have a number of ways of treating and preventing diabetes, and some of those can work well in particular individuals. At the moment, we don't have particularly good ways of knowing which treatments are going to be most effective for a given individual, and equally which ones are going to give them the most benefit with the least harm. So there's a great deal of interest in developing what's called personalized medicine or precision medicine, in which we can match the treatments and the preventions we offer to patients more accurately to their risk of disease and perhaps even to the subtype of disease that they have, so that we can ensure that they get the maximum benefit in as quickly and efficient a manner as possible. Now, genetics can play some role in that, but genetics is only part of the story. An individual's risk of diabetes is a combination of their genetics and also of their various environments that they've lived through and their lifestyle currently, which all come together to influence their risk of diabetes. What we really would like to do is to get as complete an explanation of the genetics as possible, so we can identify the genetic component of risk. We also need to do better at understanding the key environmental factors that are most important for influencing an individual's risk of getting diabetes. And in an ideal world, we would also like to have some additional measures that we can survey in individuals as they go through their life to combine with the genetic and lifestyle information to understand exactly where that person sits on their trajectory from normal health through, for example, to diabetes, so that we know exactly when the right time is to intervene.